the question's about maximum BMI to consider for surgery.
Yeah. Well, first, what is a BMI?
BMI is a very common guide in medicine in general at sort of overall balance between your height and your weight. It's not perfect because somebody can be very in shape with very low adiposity, and they can still have a BMI that would suggest that they're not. That said, we use it a lot in plastic surgery. Anesthesiologists use it a lot. Your primary care doctor is using it every time you walk in the door because it's a helpful guide about your height relative to your weight.
Yeah, I mean, all those fitness devices do track it, so I'm sure a lot of people are familiar with it. But I just wanted to get that definition in place. So for us, obviously, the more fit you are before surgery, the better outcome you'll have, right? Our goal as plastic surgeon is we do elective surgery, right? So we want to make sure that you stay in the same shape and then just, have you in a better appearance down the line. So that's really important as doctor that we make sure that you're going to be able to safely withstand the surgery that we want to do. So for people that want to have like body contouring procedure or mommy makeover or so forth, we want to make sure first that you're at your goal weight or relatively close to it. So if you come to us and you say, well, I'm going to lose 5 pounds, right? So that's not going to make a difference in if we do a surgery or not at that time. But if you say, well, I'm planning on losing 30, 40 pounds, 50 pounds, well, at that point, I think, that's great. And we really encourage that. And we're going to help you in all ways with our connection to put you in touch with nutritionists, physical trainer, and so forth. But you got to get the weight down first to be able, for us to deliver a result that's going to be safe and predictable. So to answer your question, what is the safe? Well, for a surgery center, BMI of 40 and less is what is acceptable. Above 40, they're not going to do it in a surgery center. And that's not because we don't have good anesthesiologists. The same anesthesiologists that are practicing in a surgery center practice in the hospital. So they're treating a very sick patient in the hospital, and when they come to the surgery center, it's like their vacation day because they have all healthy and relatively happy patient that's going to have surgery. So it's a good time. It's like a vacation time for them. So 40 is the number. Obviously, if you're less than 35, I think you're going to have a better recovery in terms of wound issues. We could have wound dehiscence, infection. So that would be the numbers for that.
And extending on that, people are always sort of curious, what are you thinking during an evaluation? And one of the constant thoughts in a plastic surgeon's mind is this a skin issue or is it a fatty tissue issue? And interestingly, the tools that we have for addressing fatty tissue, kind of the gold standard being liposuction, but also cool sculpting and some non-invasive procedures, they're really good at fatty tissue. Turns out they're not very good at skin laxity issues. Those are more like your tummy tuck or your facelift, where you're really mostly addressing skin. And the more a patient can shift into one or the other, the better their outcome. And so those are conversations that are difficult to have with patients when we're sort of like, look, we want you to have the very best result. And for you, that means losing 30 pounds and then coming back. At that point, we become cheerleaders and we definitely help empower them in that process. But it helps us get a result that they're most excited about. And in the end, that's the goal.
Yeah, I think, for us, what we want is treat everyone like they were a family member. I'd rather wait 6 months, a year, and have someone come back, achieve their goal weight, and then we're able to do the surgery. And the result they're going to have is going to be spectacular. And ultimately, they're going to be motivated and continue keeping their weight off. And also, like you said, you brought up the point earlier, drinking a lot of water, exercising. Those are all really important elements for a fast and good recovery.
And we could probably talk on this subject all day. We're fielding no more questions. We're just going to keep talking on this. Is that those are some of the most rewarding parts about doing this kind of surgery is that patients will more often than not use this as a major motivating tool for a lifestyle change. And the literature shows that long-term follow-ups for so many cosmetic procedures are those big turning points where they're sort of like, you know what, I want this so badly that I'm gonna change my lifestyle. I'm gonna get in better shape. I'm gonna lose some of this weight that I've always wanted to do, and now I got a big motivation to do that. And we love this. Yeah.
And oftentimes, you know, like when you come to a consultation, they come with their significant other, daughter, son, and they want to do it together, which is great. You know, I think it's like a family event, and they're really, you know, I think if you have a certain level of accountability, that helps achieve your goal. So you're accountable to us, but obviously we're the doctor, right? We could tell you not to smoke, not to do that, but ultimately you need to empower yourself to be able to make those changes in your life.
Yeah, that's a great point.